Hi guys, good evening all of you. Today I am here to discuss on a topic about a common question which I am getting from MD PSM students who have just given their exams or passed their exams in this current exam fever month of December and January and probably the first week of February. So this video is only going to tell you what you are supposed to do for next 6 months. Yes, guys. Now, if you see, the very first thing I would tell you is in the next 6 months, you have to elevate your skills. First, skills on quantitative data analysis. So guys, if you must have done your thesis or some research projects and you would have done some kind of basic analysis, you need to step it up. Second, 99.99% MD students do quantitative research. They have no idea on qualitative research. Now trust me guys, when I started my job as a faculty, the first assignment I got was a qualitative research project about which I had no idea. And I had to really toil hard that time to learn qualitative research. So my suggestion is it's a very good time if you can spend your time in learning qualitative research. Third, you can go for systematic review meta-analysis. It takes time, but trust me, once you learn it, it's a skill for lifetime. Fourth, please sharpen your basic computer skills of Microsoft Word, PPT and Excel. See guys, these are the three most important softwares which you are going to use in any job profile you are going to move ahead. And most important is writing skills. See guys, with the advent of Chat GPT, students have written their thesis using Chat GPT, and as a faculty I know that. Guys, when you would be in a job that would not work, you have to write it yourself. And that's where the best way to learn writing is to write a paragraph or 100 words and give it to your friends to correct it. Five friends can make your life miserable, but it's better to become miserable now rather than to become miserable at a job. So these are five skills I would like you to actually uplift in the next 6 months. Now I'm not saying all five. You can probably go around with two of them. Yes, two out of five is more than sufficient for the next 6 months. Now, if you look for the exams which are coming, first is the SRship exams, and also you all should be giving the DNB exams. Now, let us focus on the SRship exams. Now, guys, when you talk about SRships, I always recommend the central institutes at the top: AIMS Delhi, PGI, JIPMAR. If you don't get in these three, then please look into the next line of AIMS like AIMS Bhubaneswar, AIMS Bhopal, AIMS Jodhpur, AIMS Raipur, AIMS Rishikesh, places like this. If not in this, then even the newer ones, AIMS Nagpur, AIMS Mangalgiri. Yes, guys, these are very good institutes now to do SRship. Followed by State Institute SRships and followed by AP in private colleges. See guys, in AP and private colleges, you do get a salary, but learning is the least. So at this phase, I would like you to go and target or focus more on learning. Second, the SRship exams are interviews or written exams which are MCQ based plus minus interviews. Now MCQs are standard MCQs. So if you just have a habit of giving a quiz, which I am also running on the Telegram channel daily, 10 questions, you can easily actually crack it. Yes guys, you can see I have given the Telegram code of my channel. You can just scan it and you can be a part of it. The quiz is free. Give it every day. You will have a good practice. Now, how to approach for the SRship exams, resident course? So in DAMS, we are running a resident course for PG PSM students. If you are not a part, trust me, you should think again. Yes, guys. The resident course gives you a very good foundation on your concepts and it will actually help you in a longer run as well. The DNB theory exams comes with 4 papers, each paper having roughly 20 questions and each question is 5 marks. So there is a total of 80 questions. Even if you know 60 out of them, you easily pass the exam. Now again, for preparation, first is definitely the resident course where we discuss all these concepts, and second, just take up the last 5 years paper which is freely available on the NB website and you can just prepare it from your basic knowledge which is there as of now. Yes guys. Now Jobs, ICMR jobs. Please remember, as an MD PSM, you should be joining from scientist C and above level. Do not join a scientist B post because it is for MBBS students. MD, scientist C. UPSC CMS again is for MBBS. There's nothing specific for MD PSM. So again, I would not grade it to that extent. But still, if you are interested to get a central government job, you can definitely prepare for it. Again, the last 5 years papers of UPSC CMS is a must do. NGOs and international organizations now, as of now, the global scenario is bad. With US coming up with stringent measures, they have, I hope you know, they have already closed down on USAID. Path has started downgrading the size of the organization. US is backed out of WHO. So international organizations and NGOs, per se even in India, are not a good go for the next 6 months at least, till there is a stabilization. So probably SR ship is the best buy which you should be eyeing in the next 6 months if you do not have a bond service. Yes, guys. Now, further studies. See, no fellowships provided by any organization are recognized by MCI, so it becomes a waste. DM courses by INICT are again not MCI recognized, plus the job opportunities are very, very limited. So, again, I would not recommend for that. PhD or MPH from a global university is a good buy. So, if you can enroll yourself in those, definitely it will be the best option if you want to do it. But in MD PSM, for the jobs, generally it is the skills which matter, not your degrees. Okay, so try to sharpen your skill. Yes, guys. Now, clinical practice after MD PSM. See, guys, MD per se does not add any addition to your clinical skills. As an MBBS, you're competent enough to do clinical practice, but again, there is no loss in doing a clinical practice per se, so you're free to do it. Yes. Now, the final thing, any queries, please do not hesitate to reach out to me on my WhatsApp number. All the best, guys. You have done your part of hard work. MD is done, but now you enter into the real field. Yes. Now, guys, all the views expressed in this video are personal. The very basic reason is this comes out from my experience, which I have got in the last 13 years. I'm your host. I'm your friend, Dr. Siddharth Mishra, MBBS MD PSM from AIMS New Delhi, senior resident from PGI Chandigarh, and a DNB as well. I have got an experience of almost 13 years being in this profession, and that's what I'm trying to bring out over here to give you a good sneak peek. I put up my social media handles. Please do not hesitate to reach out on any portal. Thank you, guys. Namaste. Bye bye. See you all.